Hello, my wonderful people. So, if you have that feeling that your egg has been fertilized, but you want to know for sure, and it's still too early for pregnancy test, these are some of the signs you have to look out for. One, frequent urination. If you always see yourself running to the restroom to urinate, it might be a sign of early pregnancy. It might be a sign that a fertilized egg has been implanted to the uterus. This is caused by the increase in progesterone. Okay. Two, implantation bleeding, which is also called spotting. This do not happen to everybody, but it happens to like 25 to 35% of women. Okay. When your egg is being fertilized, the embryo travels for 5 days and gets to the uterus on the sixth day. So within 6 to 10 days, the embryo is being implanted to the uterus. Sometimes where the embryo is being implanted is very close to the blood vessel. So when the embryo penetrates the blood vessel, there will be an escape of blood. And when that happens, the blood will come out from your VJ. That's when spotting occurs. But in some women, when they see this blood coming out, they'll be like, oh God, I'm not pregnant again this month. I have to try again next month. I'm not pregnant again. I'm seeing my period. Sometimes it's not your period. Sometimes it's implantation bleeding. When you see this blood, you just check when you're seeing it. If it's like 6 to 8 days after your ovulation, it might be implantation bleeding. Implantation bleeding is usually brownish or pinkish. It's not as reddish as your normal period bleeding, okay? Sometimes you might just be seeing a little drop of blood in your cervical mucus, like your normal discharge. You might see little drop of blood, okay? Another thing you should look out for is cramps. Just imagine you're spotting and you're having cramps as well. You just believe it's your period, right? Okay. But implantation cramps is not as severe as your normal period cramps. Implantation cramps is usually mild. It's not as severe as your normal period cramps. Another sign you should look out for is when your cervical mucus keeps coming out. In a normal cycle where there is no conception, your cervical mucus usually dries up. When I say cervical mucus, is your normal monthly discharge, those discharges that used to come out from a woman's body. It keeps coming out. It might be a sign that your egg has been fertilized because the cervical mucus keeps coming out. It keeps pouring bacteria and other things away from the baby. Another one is bloating. Because of the increase in progesterone, the movement of your intestine is being decreased, so it results to bloating. In some women, breast tenderness occur at that early stage because of all the hormonal changes going on in your body. Your breast tends to become sore, swollen, and even painful. Sometimes the mouth of your breast will be protruding, or it can even become darker. So these are some of the few signs you can look out for if you think that fertilization has occurred, but you feel like it's still too early for pregnancy test. Please, if this video is informative to you, please share it out so that others can learn. Thank you for watching. Love you guys. Bye.